Hello friends, welcome to a Physio for You channel. Today we are going to learn about Qangle. So, what is Qangle? When you draw a line from ASIS to the center of patella and second line from center of patella to the tibial tubercle, the angle which is formed by these two lines called Qangle. This Qangle provides useful information about knee alignment that we will discuss later in this video. To measure the Qangle, you will need a long arm goniometer. You can measure the Qangle either lying down or standing up. Standing is usually more suitable. To measure the Qangle, place the center of the goniometer over the center of patella. Position the bottom arm in the line with the patella tendon and tibial tuberosity. Next, position the upper arm in such a way that it points directly at the anterior superior iliac spine. Now, the angle which is formed here is your Qangle. Normal Qangle for men is 14 degree and for women is 17 degree. Women usually have a higher Qangle due to their naturally wider pelvis. So now we know what is Qangle, how to measure Qangle, and what is normal Qangle. But what if the Qangle is not normal? When you have a Qangle higher than normal, you may progress to knock knee, which is called genu valgum. And when you have Qangle less than normal, you may progress to bow legs. In most of the people, the chances of getting high Qangle is more. A high Qangle means maltracking of patella is likely. As a result, patella does not travel over the front of the knee joint as it should be. Over the time, this causes microtoma to the cartilage on the rear of the patella. Eventually, this becomes pain often known as anterior knee pain, patellofemoral pain or chondromalacia patella. In most of the people, the chances of getting high Qangle is more. So we will know how to decrease the Qangle if it becomes high abnormal. Having overpronated feet also places additional strain on the Qangle and makes this Qangle high. So first step is to prevent or correct the overpronation using orthotics. The main aim is to achieve the correct biomechanics through rehabilitation program, which focuses on restoring flexibility to tight muscles and strengthening the weak muscles. Tight muscles are often the calf muscles, hamstring muscles and quadriceps muscle. The vastus medialis obliquus, which is known as VMO, is usually weak. So mainly focuses on these two muscles to treat abnormal Qangle.